Does minoxidil work? This is the most common question I hear from almost like 70 to 80% of patients. Minoxidil and finasteride are the only approved medicines for hair loss in the world. Many are patients, more than 90% of them don't know if minoxidil really works. What is minoxidil? You must have seen a lot of videos about minoxidil, but let me give you straight in this video, giving you only the scientific approach of how you should see minoxidil in a hair loss condition. Minoxidil does not fix the root cause. That is what you need to remember. So the main cause of hair loss is DHT dependent thinning of the hair follicle. Minoxidil does not work there. Minoxidil works by many mechanisms which are not all defined till now, but broadly, it increases the blood circulation, it improves the overall environment of the hair follicle. And minoxidil, the harsh truth about minoxidil is it works only as long as you're using it. Minoxidil only controls the hair loss, and in many conditions, it actually improves the overall density. But you have to remember that once you stop minoxidil, all the hair that are gained can be lost. So for me, starting minoxidil for a patient is a very important decision. I just don't write minoxidil prescription to randomly. Why? Because I know that if I'm starting minoxidil for him, that means I am planning to keep the minoxidil for him for life. When you start minoxidil, you have to know the timelines. These are very important. Minoxidil does not give the results right away. There is a 2 to 3 weeks shedding that happens, which is normal for everyone. The results of minoxidil you only see after 2 to 3 months. So this is what you have to remember. And here you don't see increase in the hair growth whatsoever. You're just seeing only a stop in the hair loss. The actual hair growth happens in 6 to 8 months. So you need to be patient till that time. And minoxidil has to be used appropriately. There is a proper way of using the minoxidil, proper quantity, and what time, how many times you're using them. All these things do play a huge role in the success of minoxidil. And coming to the side effects, so basically it does not mix in water, so it is basically an alcoholic preparation which tends to dry your scalp, which can lead to itching, rashes, and increase in the scaling part of it. And there are other side effects that can happen, like in some patients there can be a little bit of headache and lightheadedness. Patients do come and tell me that minoxidil will cause sexual side effects, which is completely wrong, because there is no relation whatsoever between the sexual side effects and the minoxidil component of the medicine. You have to be consistent with it to get the best results. I start minoxidil after considering all these factors and telling the patient, giving him inputs about the medicine. And minoxidil will work as a good foundational therapy for long-term hair loss management. There is no taking away from this fact, which has been proven in many scientific papers and research throughout the world.